Rheumatoid arthritis is an autoimmune disease. Look at this picture, shows that this is CT finding, an MRI, then X-ray shows that normal hand and rheumatoid arthritis, damage, joint, bone. Detail going on. Rheumatoid arthritis is a chronic autoimmune disease characterized by inflammation of joints leading to pain, swelling, stiffness, and eventual joint destruction. It is a systematic condition that can affect various body systems, resulting in a range of symptoms and complications. Definition: Rheumatoid arthritis is an autoimmune disorder where the immune system mistakenly attacks the synovium, the lining of the membranes that surround the joints. This leads to chronic inflammation, which can damage cartilage, bones, and other tissues over time. Types: there are several types of RA which can be classified based on different criteria. 1. Seropositive rheumatoid arthritis, the presence of rheumatoid factors or anti-citrullinated protein antibodies in the blood. Second, seronegative rheumatoid arthritis, the absence of these antibodies in the blood. 3. Juvenile idiopathic arthritis that occurs in children under the age of 16. 4. Palindromic rheumatism characterized by recurrent episodes of joint inflammation that resolve on their own. Causes: the exact cause of RA is unknown, but several factors are believed to contribute. 1. Genetics. Certain genetic markers, example HLA, DR4, are associated with an increased risk. Second, environmental factors, smoking, exposure to silica, and infections may trigger the disease in genetically susceptible individuals. 3. Hormonal factors. Hormones may play a role as RA is more common in women and often flares up Postpartum. Risk factors. Several factors increase the risk of developing RA. 1. Gender. Women are more likely to develop RA than men. 2. Age. Commonly begins between the age of 40 and 60. 3. Family history. Having a family member with RA increases the risk. 4. Smoking. Cigarette smoking is a significant risk factor. 5. Obesity. Excess weight can contribute to the development and progression of RA. Complications. RA can lead to various complications including 1. Joint damage, permanent joint destruction, deformity and loss of function. 2. Cardiovascular disease, increased risk of heart disease and stroke. 3. Lung disease, interstitial lung disease and pleuritis. 4. Osteoporosis, increased risk of bone fractures. 5. Eye problems, dry eyes, scleritis. 6. Infections, increased susceptibility to infections due to the disease and its treatments. Pathophysiology of rheumatoid arthritis. Steps. 1. Autoimmune reaction. The immune system mistakenly targets the synovial membrane, considering it a foreign body. 2. Synovitis. Inflammatory cells, example T cells, B cells, macrophages, infiltrate the synovium, causing inflammation. 3. Cytokine production. Inflammatory cytokines such as tumor necrosis factor alpha, interleukin 1 and interleukin 6 are released. 4. Pannus formation. Pannus inverts and erodes articular cartilage and bones. 3. Cartilage degeneration. Loss of cartilage leads to joint space narrowing and loss of joint function. 6. Bone erosion. Osteoclasts are activated by cytokines and begin to break down bone tissue. 7. Joint deformity and dysfunction. Continued inflammation of tissue damage result in joint deformities, instability and loss of function. 8. Systemic effects. The inflammatory process can extend beyond the joints, affecting organs such as the lungs, heart, eyes. Chronic systemic inflammation contribute to increase cardiovascular risk and other complications. Understanding these steps is crucial for developing targeted therapies to interrupt the disease process and prevent joint damage in rheumatoid arthritis. Signs and symptoms. Common signs and symptoms of RA include 1. Joint symptoms, pain, swelling, stiffness, especially in the morning, and warmth in the joints. Second, systemic symptoms, fatigue, fever, and loss of appetite. 3. Symmetrical patterns often affects the same joints on both sides of the body. 4. Rheumatoid nodules, firm lumps under the skin near the joints. 5. Deformities, long-term inflammation can lead to joint deformities. Medical diagnosis. Diagnosis of rheumatoid arthritis involves a combination of clinical evaluation, laboratory tests, and imaging studies. 1. Clinical evaluation. Assessment of symptoms, physical examination of joints. 2. Laboratory tests, rheumatoid factors, RF, anti-citrullinated protein antibody, ACPA, erythrocytic sedimentation rate, ESR, C-reactive protein, CRP. 3. Image studies, X-ray to detect joint damages, MRI and ultrasound for detailed images of joint on soft tissue environment. Nursing diagnosis. The nursing diagnosis for rheumatoid arthritis patients may include 1. Chronic pain related to joint inflammation and damage. 2. Impaired physical mobility due to joint stiffness and pain. 3. Fatigue associated with chronic inflammation and pain. 4. Disturbed body image related to joint deformities and functional limitations. 5. Risk for infection due to immunosuppressive treatments. Management of rheumatoid arthritis involves a multidisciplinary approach. First, non-pharmacological treatment. 1. Physical therapy to maintain joint function and mobility. Second, occupational therapy to assist with daily activities and use of adaptive devices. 3. Exercise, low impact exercise to improve strength and flexibility. 4. Dietary changes, anti-inflammatory diet, maintaining a healthy weight. 5. Surgical treatment, joint replacement or repair for severe joint damage. Treatment, mainly pharmacological treatment. 1. Non-steroidal anti-inflammatory drugs for pain and inflammation. 2. Corticosteroids for short-term inflammation control. 3. Disease modifying anti-rheumatic drugs. Example, methotrexate. 4. Biologic agents, TNF inhibitors, IL-6 inhibitors. Psychosocial medicine. Rheumatoid arthritis can have significant psychosocial impacts. 1. Emotional support, counseling or support groups to cope with chronic disease. 2. Education, providing information about RA, treatment options and self-care strategies. 3. Stress management, techniques such as mindfulness, relaxation exercises and cognitive behavioral therapy. Prevention. While rheumatoid arthritis cannot be completely prevented, the following measures may reduce the risk. 1. Healthy lifestyle, regular exercise, balanced diet, maintaining healthy weight. 2. Smoking cessation, avoiding or quitting smoking. 3. Early detection and treatment, prompt treatment of early symptoms to prevent joint damage. Conclusion. Rheumatoid arthritis is a complex autoimmune disease that requires comprehensive management to control symptoms, prevent joint damage and improve quality of life. Early diagnosis and multidisciplinary approach involving pharmacologic and non-pharmacologic treatment are crucial, addressing the psychosocial aspects and educating patients about self-care and also significantly impact on overall management of rheumatoid arthritis. Thank you. Have a nice day.